Ever found yourself checking the door lock multiple times before leaving your house? Or perhaps you've come across someone who repeatedly washes their hands out of an intense fear of germs. These actions might seem quirky or excessive to some, but for many, they are part of a daily struggle with a mental health disorder known as obsessive-compulsive disorder, or OCD. Obsessive-compulsive disorder is a chronic condition where a person has uncontrollable recurring thoughts, known as obsessions, and behaviors they feel compelled to repeat over and over, called compulsions. These obsessions and compulsions interfere with daily activities and cause significant distress. The obsessions are intrusive and unwanted thoughts, urges, or mental images that cause anxiety or discomfort. They can revolve around a variety of themes such as fear of germs or contamination, unwanted taboo thoughts, or a need for symmetry and orderliness. The compulsions, on the other hand, are repetitive behaviors that a person with OCD feels driven to perform in response to an obsessive thought. Common compulsions include excessive cleaning or hand washing, arranging items in a particular way, repeatedly checking on things, or compulsive counting. The impact of OCD extends beyond the individual. It can strain relationships, disrupt routines, and in some cases, it can completely incapacitate the person. It's not uncommon for someone with OCD to spend hours each day on their rituals, leaving little time for anything else. However, it's important to understand that OCD is not a character flaw or a sign of weakness. It's a serious mental health condition that requires understanding, empathy, and appropriate treatment. Treatment for OCD typically involves psychotherapy, medication, or a combination of both. Cognitive behavioral therapy is a type of psychotherapy that seems to be the most effective in treating OCD. It involves gradually exposing the person to the feared object or obsession, such as dirt, and having the person learn healthy ways to cope with their anxiety. Medications such as certain types of antidepressants can also be helpful. But like all medications, they can have side effects, and it's important to discuss these with a healthcare provider. In summary, obsessive-compulsive disorder is a chronic mental health condition characterized by unwanted obsessions and compulsive behaviors. It can significantly impact a person's daily life and relationships, but with the right treatment and support, people with OCD can lead full and productive lives. It's essential to understand that OCD is not a choice, but a disorder that requires empathy, understanding, and appropriate treatment. Remember, mental health is just as important as physical health, and it's okay to seek help.